Welcome back to the Get Well podcast. I'm Dr. Kevin from Dr. Kevin's Wellness Clinic right here in Lafayette, coming to you from my beautiful new office behind Women's and Children's. I wanted to start by thanking everyone for the amazing response that we got on last week's podcast. People were so excited. We got a huge success from that. So I just wanted to thank everyone. And on last week's show, we talked about complicated digestive issues like IBS, GERD, reflux, etc. And I had said that I was going to save Crohn's disease for this week because Crohn's disease is really more of an autoimmune problem. So I wanted to expand on that idea today and get into this whole issue of autoimmune disorders because many people don't really understand what autoimmune disease means or how prevalent it has gotten in today's society in America. But I'm here to tell you, autoimmune disease is now one of the most common disabling, deadly conditions in America. Autoimmune disease is by far one of the most common killers in America today. And you might think, well, Doc, hold on, that's not true. It isn't even in the top 10. And here's what's wrong with that. If you Google the top killers in America today, you're of course going to find cancer and heart disease as the top two. However, whenever it comes to autoimmune diseases, the whole idea of autoimmune gets broken down to its individual diseases. So rheumatoid arthritis is on the list, Crohn's disease is on the list, MS and lupus and so on. It's broken down into their individual types. We don't do that with cancer. Cancer gets lumped into one giant category as cancer being the number one killer in America or the number two. But if you broke cancer down like they do to autoimmune disease, skin cancer and stomach cancer and bone cancer, it would be pretty far down on the list. And if we grouped autoimmune diseases together like they do cancer, you would be blown away to see how prevalent this has now become in our society. Autoimmune disease means that your body's own immune system, the very same immune system designed to kill bacteria and viruses, has now turned against you and it's attacking your own tissue. So your immune system is attacking the body. Now, there are over 100 known autoimmune diseases that can be diagnosed in the body, and that number is growing every single year. And so that means that the immune system can now attack 100 different parts of the body or different tissues or organs in the body, creating disease. And here's the truth. And I'm going to get into this some more today, but here's the truth. Our bodies have become so overloaded and stressed out and confused and polluted that our own immune system can't even recognize what's our cells and what are foreign invaders that need to be attacked. Our immune systems are so overwhelmed and our bodies are so confused by all the junk that's in our bodies that our immune system can't even determine what's us and what's not us. Now, quick fair warning here. You may have been checked for autoimmune disease and were told that you don't have an autoimmune problem. Most of the time when patients are told this, they get checked for two things: lupus and rheumatoid arthritis. And if they don't test positive for those, they're told they're not autoimmune. But keep in mind, there's 100 other possibilities of tissues that can be attacked. So from a wellness perspective, we find that many of today's conditions have an autoimmune component to them. Even things like diabetes and psoriasis and eczema have what we call a secondary autoimmune component. So guys, this is serious. This is a really big deal. And we're going to get into Crohn's specifically a little bit later in the show. But it's important for you to understand the commonality of all of these autoimmune diseases and the way this works. Because they name an autoimmune disease based on the tissue the immune system is attacking. So if my immune system is attacking my joints, it gets called rheumatoid arthritis. If my immune system is attacking my nerves, it gets called MS, multiple sclerosis. If it's attacking my thyroid, it gets called Hashimoto's disease. And I could go on listing other tissues. But here's the thing. It really doesn't matter what tissue is being attacked. The immune system is where the problem lies. It's the immune system that's malfunctioning. In traditional medicine, if the joints are being attacked, we just treat the joints. If the thyroid is being attacked, we just treat the thyroid. If the tissue is under attack, that's not the problem. The immune system is the problem. I see so many patients that will have autoimmune thyroid and they're just treating their thyroid, just taking Synthroid, and that's just like throwing gasoline on the fire. That's just giving the immune system more to attack. The thyroid is not the problem. It's being attacked. The immune system is the problem in the body. You know, it's like in a crime. If a criminal comes and mugs you and takes your wallet, well, that's not your fault. That's the criminal's fault. And in autoimmune disease, it's not the tissue's fault. It's the immune system that's doing the damage. If your immune system is attacking a patient's joints and all I do is support their joints, I'm never really getting to the underlying problem. I'm never even getting to the right system in the body. If the immune system is attacking the colon and I label you Crohn's and just treat your colon, I'm never getting to the underlying cause of the problem in the first place. I'm not even on the right system. The most concerning part of all of this is up to 50% of the time, if you have one autoimmune disease, you will have a second or third autoimmune reaction that you don't know about. So you may have been diagnosed with rheumatoid arthritis and not realize it, but you have a secondary autoimmune condition in some other part of your body. Maybe it's your colon and didn't realize it. Maybe it's your thyroid and you didn't realize that either. But up to 50% of the time, if you have one autoimmune disease, you will have another one. So I wanted to run through a few of the things on the show today that could be some of the underlying issues that's causing the immune system to respond this way, to causing the immune system to react, because that's something that's rarely talked about. In Crohn's disease, the immune system is attacking the lining of the colon, and we need to know why that is and what's doing it and why the body would respond this way. And so from a functional wellness perspective, we want to start asking the question of what would make that happen? Why would the body do that? So I wanted to run through 3 or 4 things that could be causing the immune system to get so confused that it's attacking the own body. But I want to tell you, this gets kind of complex, and you don't have to figure all this out on your own. Our testing is going to prove a lot of these reasons out, but today I just wanted to speak on it and give you a few things that could be irritating the immune system to the point that it's gotten confused and it's decided to attack the own body. Now, a really important one is what we talked about last week with this leaky gut syndrome. And what that means is the barrier between your food and your body is letting your food pass too quickly. So when you eat a salad, you should get that salad broken down to carbohydrates. And then those carbohydrates cross out of your digestive barrier and into your bloodstream to make energy. But if you eat a salad and you get chunks of lettuce in your bloodstream undigested, that's called leaky gut, and it's very inflammatory, and it can lead to this reaction. Imagine a rubber glove with a hole in it. The food leaks out into your body too soon. Now, we have some very specific ways that we can test to see if this is part of the problem, and very often we find that it is. Now, leaky gut doesn't show up on traditional tests like scopes and scans and all of that. We have a very specific way that we have to test for this. Now, heavy metals are another thing that we find. Heavy metals like lead, mercury, and cadmium can irritate the colon wall and create an inflammatory response. And you'd really be surprised how often we find patients with heavy metal toxicity in Louisiana. We find lead in patients every single week. We find mercury every single day almost, and on most days. But if you get these heavy metals trapped in the lining of your colon, it will create an inflammatory response that can cause your immune system to go and try to attack that. If you get mercury toxicity in your thyroid, which happens all the time, your immune system will react to that. And like I said, this gets a little bit complicated, and you don't have to try to figure all this out on your own. That's my job. Complicated is what we do. And likely, there are multiple reasons that your body has turned autoimmune. But you have to figure out what all those reasons are, what all those puzzle pieces are, and begin to eliminate them one by one. Otherwise, this autoimmune reaction, it will never stop. Now, another important thing that we look at for the causation of autoimmune disease is something that we call stealth infections. Now, what that means is that somewhere in your body, you have a hidden infection agent, like a virus or a bacteria, and that you don't know that you have it. These infections aren't severe enough to give you a fever or make you feel like you need to go to the doctor, but they also are not totally eliminated either. These latent infections can linger in your body and aggravate and irritate your immune system, sometimes for years. They could be in the digestive tract. They're very often in the sinus cavities. Very often they're in the dental work, teeth and root canals, and other places in the body. But the average person doesn't realize how many infectious bacterias and viruses and amoebas and parasites and things they're walking around with on a day-to-day basis. Sometimes we carry viruses and bacteria around our entire life. And so there's many different stealth infections that you could be exposed to that can activate your immune system, causing these autoimmune reactions. Guys, it's not good enough just to treat the end result if you have these autoimmune conditions. It makes no sense just to treat your thyroid if your thyroid is being attacked, or to treat your colon if the colon is being attacked, or just palliative care to patch things up and let your autoimmune condition continue. It's just not good enough. We need to see what combination of things is causing it so that we can see how it can be eliminated. And there's lots of reasons that this could be happening, and I've covered a few of them here, but there are many other things that I didn't really have time to get into that could be creating these autoimmune reactions in the body. Now, in traditional therapies, autoimmune is looked at completely differently. So someone with lupus would be completely unrelated to someone with Crohn's disease, which is completely unrelated to someone with rheumatoid arthritis or some other autoimmune disease. But the common denominator in all of these conditions is that the immune system is malfunctioning. It's attacking. And once it starts to attack, it can go attack other areas as well. And I'm going to repeat this again. Our bodies have become so confused and polluted and overwhelmed that our immune system doesn't even recognize its own cells anymore. The only difference between Crohn's and lupus and rheumatoid is the tissue that the immune system is attacking. But the common denominator, the common thing with all of them, is the immune system is making a mistake and it's attacking the tissues that it shouldn't be. And from a functional wellness perspective, from a functional medicine perspective, How many different ways can we get the immune system to calm down and relax and chill out, as we say around the office a lot of times? If your immune system is mad and irritated, how can we get it to chill out? And we have to figure out what all of those reasons are and then put a plan in place to solve them. And guys, this is some pretty powerful stuff when it comes to working with autoimmune diseases. And something that I try to explain to people very often is that, number one, it's complicated. And number two, there's multiple things that's more than likely causing your immune system to go haywire. And so it's usually 3 or 4 things in the body. And if we find that, it isn't good enough just to treat 1 or 2. You really have to sit down and figure out a plan that we can solve all of these problems at one time as part of a strategy. Otherwise, once your immune system flips that switch and it starts to run haywire and attacking tissue, it will never stop. Autoimmune disease is caused by a bunch of little failures, but once it flips that switch, it's really hard to get it to stop unless you know what you're doing. Once it becomes angry and confused, to get it to chill out sometimes is complicated. So for example, if you're mad at me about 5 different things, and I sit down with you and we have a long talk and we resolve all 5 of those things 100% and we hug and we move on, you aren't going to be angry with me anymore. So if we sit down and we find out all of the reasons that your immune system is mad and confused and we eliminate them one by one, that's how we get in the ballpark of solving these issues once and for all. Well, thank you guys so much for joining me. My purpose, my passion is to try to help as many people as possible live a better life through totally natural solutions. You know, in May, I'm going to celebrate my 25th year in practice. And over the last 25 years, I've seen thousands of difficult cases. It's important that you don't feel like you have that one problem that can't be resolved. I talk to so many patients that feel like that they have that one difficult thing and they've convinced themselves that their problem is unique. And although other people may be getting help here, they're different and their problem is unique and it can't be solved. Don't fall into that trap. Don't fall into that pathway. Thank you guys so much for joining me. I'm Dr. Kevin from Dr. Kevin's Wellness Clinic here in Lafayette. If you're interested in talking to me about your health problems, if you want to sit down knee to knee with me to see if my methods may be able to help you, all you have to do is call my office at 983-CARE and schedule an hour's time to come in and sit down with me and see if we can figure out what your individual pathway is to solving your complicated health problems. See you next time. Love you, Acadiana.